I'm Dr. Melissa Danchak with Danchak Audiology and Hearing Aids in Arlington, Texas, and Advanced Hearing Aid Center in Fort Worth, Texas. I want to talk to you today about the subject of over-the-counter hearing aids. As many of you know, the FDA approved these devices earlier this year, and they became available earlier this month. Since then, I've had many people ask me for my opinion on this topic, so I thought it would be good to discuss today. The FDA created this category of over-the-counter hearing aids in an effort to provide easier access and more affordable solutions for people living with untreated hearing loss. At Danchak, we recognize the devastating consequences of living with an untreated hearing loss, which can include increased risk for cognitive decline, increased feelings of isolation and separation from family members and loved ones, and difficulties communicating at work, which can lead to reduced income or loss of income. So that's why we wholeheartedly support the idea of easier access for treatment for people with hearing loss. With that in mind, I want to stress to you the importance of having a hearing test performed by a professional prior to being fit or getting amplification. This type of testing helps us to rule out if the hearing problems you are having are maybe in fact caused by a buildup of earwax, ear infections, or one of many other medical conditions that require a medical referral, or if in fact you do have a hearing loss that should be treated with amplification. The testing will help us to determine the type and pattern of your unique hearing loss so that we can decide if you are a good candidate for over-the-counter hearing aids or if you really need a prescription device. So, who is a good candidate for over-the-counter hearing aids? Well, first and foremost, the FDA approved over-the-counter hearing aids for adults 18 and older. So if you are younger than this, over-the-counter hearing aids are not a good option for you. Secondly, these devices are limited in their volume level, their design, their technology, and style. So they're really meant more for people with milder degrees of hearing loss. Think of it like reading glasses for your ears. As your hearing loss progresses, the need to be seen by a professional and fit with good quality devices increases. As doctors of audiology, we have the training and expertise to make sure that the hearing aids are programmed for your specific pattern of loss so that you get the necessary acoustic stimulation up to the brain, while also making sure you're not getting so much that it could cause further damage to your ears. My more than 25 years of experience has also taught me that the most successful patients are those who are seen for regular follow-up care and services. These follow-up appointments allow us to be able to monitor your hearing loss for any changes and make appropriate adjustments to the devices. We can also ensure that their aids are functioning properly, and we can answer any questions and concerns that you may have along the way. Lastly, while the over-the-counter hearing aids were meant to provide a more affordable option, ranging somewhere from $500 to $1,000 for the devices, they're not the only affordable option that's out there. More and more insurance companies are providing some type of coverage or benefit for hearing devices. This includes many of the Medicare replacement plans. So through these plans, you're able to have access to high-quality devices fit by a professional, oftentimes with a cost that's similar to, and sometimes even less than, what the over-the-counter hearing aids are. So before going out to pursue amplification, make sure you get your hearing tested and talk to a professional about what the best options might be for you, and then make your decision based upon your needs and your lifestyle. If you have any further questions, please feel free to call my office and set up an appointment, and we'd love to discuss this in more detail. Thanks for listening and have a great day.